Are you an IBS baddie? I'm seeing this term run rampant on social media. And yes, it's true that women struggle with constipation issues so much more than men. But did you know that it can be directly linked to your pelvic floor? So if you've seen this term, it's kind of a running joke that like hot girls, quote unquote, right, have stomach issues. And a lot of the issues that hot girls or regular girls or any female can have related to constipation or IBS type symptoms are often related to the pelvic floor. So digestive issues and pelvic floor issues are very closely related and linked, and I'm going to talk about why, but I'm going to also give you at the end of this video a way for you to start helping your pelvic floor so you don't have to deal with some of these constipation issues and IBS type symptoms, because they can be really uncomfortable and they can lead to feeling bloated and just gross and feeling like you need to empty out. And so you might get hooked on like some supplements, Miralax, Ducalax, some of the other stimulants that help clean you out but is not natural, and it's not dealing with the root cause of what can be happening when you experience things like IBS symptoms, constipation, even diarrhea. So we're going to get into that topic today, and we're going to talk about how it's related to the pelvic floor. First, I just want you to know that the pelvic floor is the bottom of your core. So if you've heard of the pelvic floor before, it is the sheet of muscles underneath the pelvis. So when you poop, your pelvic floor has to actually relax in order for the poop to get out. Now, a lot of times people have really tight pelvic floors, especially if you work out a lot, you have anxiety or stress in your life. Our pelvic floor automatically becomes really tight and has a hard time relaxing. And if it gets stuck in that tightened position, then it becomes really hard in order to get any type of relaxation. And the relaxation that you get is often not enough to have a good, complete bowel movement in order to fully relax so the poop can get through. So we're going to talk about that today. So the pelvic floor is the bottom of the core. And of course, here's the vagina. Then you have the anus, so where we poop out of. Then we have the urethra, where we pee out of, and the clitoris up here. This is the perineum, or what it's often called is the perineum. And the front part is the vulva. So the area that contains the vagina and contains the clitoris and the urethra is often called the vulva, or related to as vulva. And so pelvic floor, when it gets tight, it squeezes shut the anus more. And so I'm going to show you how these organs are lined up and how sometimes the colon can't fully empty if the anus is squeezing tight. Okay? So if you look at the pelvis here from a side view, we have our little bladder. That's where our pee is held. We have our uterus, which the bottom of the uterus is the vagina, and the top of the uterus is the cervix, the top of the vaginal canal is the cervix, right at the bottom of the uterus, okay? And on the back side, we have the rectum. So the colon comes down and fills what's called the sigmoid colon, and then it fills the rectum. So the rectum is the backside of the vagina. Well, when you have IBS type symptoms or you have constipation, what can happen is the rectum can get really full before it totally evacuates. And if that happens, that's going to put pressure down inside the actual vagina. And so that's not good for the body, because then it can create things like pelvic organ prolapse, where you get this like pressure sensation in the pelvic region, and the organs can kind of like descend into the vagina or like fall into the vagina. That's called a pelvic organ prolapse. Not to mention that when you have a really full colon, it's sitting on top of the bladder and the uterus, and that's a lot of pressure on all these organs to go down into the vagina. So that can cause things like incontinence, so like peeing your pants. So like if you sneeze and cough and then you pee, that can increase the likelihood of incontinence, urinary incontinence. And it can also increase the likelihood of fecal incontinence. So when you poop when you don't want to be, or if you like fart a little bit and some poop comes out, it can be due to some of that, like having too much stool in the colon. And so how is this related to your pelvic floor, you ask? Well, when you digest food, it empties the stomach and it goes into the small intestine, which then goes into the large intestine, which is the colon. The colon pumps the stool through the entire entire colon. So it goes ascending, transverse colon, then descending colon into the sigmoid colon. And the poop has to make that whole route. And what happens then is it comes through the rectum and goes through the pelvic floor. So you can see it goes through the pelvic floor. And then you get the urge to poop, and then it comes out. So what happens if you have IBS type symptoms, diarrhea, constipation, or just constant bloating, and you're not getting like a full good bowel movement, is a lot of times you get a lot of tension inside the pelvic floor. So the pelvic floor becomes really tight, and it's hard for the pelvic floor to relax for the poop to fully exit. So how do we help this? How do we get control of the pelvic floor? Number one, everyone who's dealing with any kind of stomach issues should always visit a pelvic floor and a pelvic expert physical therapist, someone who's going to take a look at these pelvic floor muscles. They do that intravaginally, looking at these muscles, touching these muscles, releasing these muscles, and helping open up so that there's more stretch to them. A healthy pelvic floor can stretch and contract, but if it's stuck in a contracted spot, it actually gets really weak and we don't have as much strength. So we want the pelvic floor to be able to relax and open. So visiting a pelvic expert physical therapist is very essential for helping get the stool through the colon. Okay, number two, we want to make sure that we are not pushing the poop out. Because if we get an urge to go to the bathroom and have a bowel movement, and we go and then we're pushing, we're actually straining our abdominal walls. So we want to breathe the poop out. How this works is in a sitting position. Oftentimes we recommend being in a forward flex position or using a squatty potty so your knees are elevated above the actual hip joint. But if you don't have a squatty potty, then just simply lean forward. When you're leaning forward, you're going to take a nice deep breath into your belly, so it looks like this. And then exhale all the air, letting it go. You'll do that 3 times. And on the third one, you'll inhale, not letting the chest rise too much. You want the air to come into belly. And then on the exhale, letting it go. And again, on the third one, at the top of the inhale, you're going to inhale and open. And then you're going to bear down and fart as if no one can see you fart. So it's a really small bear down. And again, if you're pushing, it's going to be too much tension in the belly, which is also going to create more tension in the pelvic floor. So our goal is that as you inhale, the pelvic floor is going to open. And as you exhale, you do get some recoil. But as you inhale and open, then the stool can exit the body with a lot more ease. So you don't have to strain and push, which is also going to increase the risk of pelvic organ prolapse, hemorrhoids, anal fissures, and have a lot other detrimental impacts. So if we can breathe the stool out, it's going to help the pelvic floor and help the tissue around it. Now, if your pelvic floor is so tight that you're only, like your colon has to get so full in order for you to get at least some of a bowel movement, and you just don't feel like you're getting everything out, or you still feel really bloated afterwards, it's most likely due to the pelvic floor, again, not fully opening. And so you're probably stuck in a really tight position. What is really bad for that is Kegels. So the number one thing you should not do is Kegels, because that's going to tighten things up and actually make things worse. And our goal is to actually open them so the stool can exit. And again, your pelvic floor is actually stronger and your entire core is stronger if you can get that range of motion of the pelvic floor. Most people don't need to be working on the Kegels and the contraction part. The strength comes from the relaxation part. You're actually stronger if you can get more range of motion from it relaxing. So that is the number one thing not to do, would be not to do Kegels. Then the first thing I want you to do is make sure that you're breathing the poop out. And then just in your daily life, probably set a timer for this. 5 minutes a day, I want you to do some nice belly breathing. So what this looks like is if your hand is on your chest and you have a hand on the belly, you want to just breathe in, see where the air goes. When you inhale, does the air go all the way up here? Is it going into your chest, into your rib cage, or is it going into your belly? for a lot of women, it's hard for them to expand our bellies because we're constantly like holding them in and sucking in and trying to make our waist look smaller. And if that's the case, then what happens is we train our core to not expand, and that limits the transit of the poop. And so we have to train our breath to actually go into our belly. So it looks like this. Exhale. But if when you inhale, it goes all the way here, and exhale, and you can't get the air to go into the belly, then you want to work on retraining and getting the air to go into your belly. Why we do that is if you can retrain the air going into your belly, it's going to also train your pelvic floor to open and relax and get that powerful movement of opening the pelvic floor. So as you inhale into belly, it's helping pelvic floor open in a direction that it doesn't usually get to open. If you're just breathing up here and exhaling, the pelvic floor is pretty locked and the core is really tight and doesn't relax. Now I understand you want to have a flat stomach and you want to pull in your core all the time and you want to have a cinched waist or snatched waist, right? But this actually makes that stronger. This doesn't change that, okay? Because if you train yourself, you can still hold your tummy tight when you want to and whatnot, but if you train yourself to open up these muscles at a resting state, they're actually going to be stronger. And so just 5 minutes a day of breathing into the belly and exhaling and breathing into the pelvic floor is going to help open things up so these muscles are stronger. So it's all over social media about being an IBS baddie, right? But the reality is a lot of times people are just, their cores are so sucked in and their pelvic floors are so sucked in, they're just not getting that motion. Add in waist trainers and we just got a whole nother problem. So we gotta get this range of motion. You gotta at least breathe into these muscles 5 minutes a day, and that's gonna help tremendously with the IBS symptoms. And definitely get an evaluation by a pelvic expert physical therapist. I'm Dr. Allison Felt. Thank you so much for tuning into this video. I hope you found it valuable and helpful with these tools. Please like, subscribe, and share this information to all of your friends because everybody should know this. We should know how to poop, know how to breathe into these muscles. I promise you it will make your pelvic floor stronger. And number one reminder is do not do Kegels. Please drop a question in the chat. I would love to answer it. Let me know how long you've been struggling with constipation or stomach issues. And we are here for you. Take care.